Hello? Hello?
Yes, hello, this is Adam.
هاي دكتورة مها، ازيك؟ اخبارك ايه؟
اخبارك ايه؟ الحمد لله تمام الحمد لله.
الله يخليك، كله تمام الحمد لله، الله يخليك، كله بخير. بقول لك كنت هسألك دكتورة، هو انا ينفع شير سكرين ولا ما ينفعش العدد كبير؟
مش عارفه والله. وثق كان اسد احمد.
هلو. صباح الخير.
حبيبي
احنا
حبيبي
هنبتدي كمان
صباح
صباح
الخير.
إيه الاخبار؟ عاملين إيه؟ الحمد لله. احنا هنبتدي كمان دقيقتين بالظبط، فونس ان يجي
احمد
وقت
انا ينفع اشير سكرين؟
يس ينفع، مفيش مشكله. وانس ان يجي وقت حضرتك هعمل لك شيرنج سكرين، يعني هديك بيرميشن.
طيب خلاص، اوكي ثانكس.
ماشي. لا
السلام عليكم. مساكم الله بالخير دكتور.
السلام عليكم. السلام، ازيك يا اردي؟ ازي حضرتك؟ الله يخليك.
حياكم الله. الحمد لله حياكم الله. دكتورة معها كيف الحال؟
الحمد لله بخير الحمد لله.
موفقين ان شاء الله في الاجتماع هذا.
يا رب ان شاء الله ان شاء الله. يعني very important to us. يعني it's important that we include them and see how they can contribute to this pandemic, and it's going to be the future anyway, the new world living.
اكيد. الله يسهل لهم ان شاء الله.
بالضبط، الله يسهل لهم امورهم ان شاء الله.
ان شاء الله.
Hello, everyone. Welcome to this webinar. Today's webinar is on young people at the front lines in COVID-19 pandemic response. My name is Wasik Khan, and I'm very pleased to welcome you here in Cairo, and I'm part of the WHO Regional Office team for the Eastern Mediterranean. I'm pleased to say that this webinar is a joint activity among WHO, Office for the Secretary General's Envoy on Youth, the 3 global and regional youth organizations which represent Association of Students of Medical, Dental, and Pharmaceutical faculties. The meeting today will be 1.5 hours. We have divided the agenda into 3-4 different sessions. We will have panels of young people and seniors, and then we will have a plenary discussion as well. For the webinar, we are very grateful and honored to have the UN Secretary General's Envoy on Youth, Ms. Jyatma Vikramanaike, who is based in New York, and she has joined us graciously from New York at a very early in the morning. Thank you, Jyatma, for joining us. We are also grateful for the WHO Regional Office Director, Dr. Ahmed Al-Mandari, who's sparing his time out of his busy schedule. And we are also grateful to all of you, young people joining from different countries, our collaborators, UN organizations, as well as non-UN partner organizations. Before proceeding, I would like to draw your attention towards some house rules. These are simple, straightforward house rules, but in technology environment, they are important for us to have a nice and pleasant experience of this meeting in which we can hear from each other and also share our comments and details as we move along. First, the meeting is being recorded. Second, please turn off your cameras and mute your microphone during the presentations if you are presenting or making a comment. Third, you will be able to raise questions either by writing in the chat panel or by using the raise hand tool, which is in WebEx and which you might be familiar, which is on the right side of your panel screen. Last but not least, in case of speaking, we would really request you to stick to your time that has been allotted in terms of if you are a presenter or if you are making a comment as a participant in the plenary discussion, please be brief as much as possible to have this meeting completed on time. With this, I'll request our opening remarks for Dr. Ahmed Al-Mandari, the Regional Director of WHO Regional Office for the Eastern Mediterranean. Dr. Ahmed, please, the floor is yours.
Bismillah ar-Rahman ar-Rahim. Thank you very much, Wasaq, for this introduction. And in fact, before I give just my opening remarks, I'd like to thank you and Dr. Maha as well, and all colleagues and the team who supported you and bringing us together into this important meeting. And for us, working with youth and bringing youth into whatever WHO is doing at its headquarter, regional or country levels is very essential, very important. Here in EMRO, in fact, with this new vision, EMRO Vision 2023, and it was before, I must say it was before, before the vision that we have established in 2018, it was there, the involvement and including youth in whatever work WHO is doing. But we thought, I think now, the time has come for us to strengthen this area, involving youth in whatever work WHO EMRO is doing at regional and country levels, include them in whatever discussions, include them in whatever platforms, through committees, groups, teams, either through sort of technical discussions or even at a platform of decision making sometimes that is needed. It is the future, that we are talking about. Involving them, we will not be able to plan right and put the way forward in a very strategic manner. So their involvement is very essential and very mandatory for us. And I assure them that we are fully committed towards that, inshallah. So thank you again, Wasaq and Dr. Maha and the team for arranging it. And dear Ms. Gathma, UN Secretary General's Special Envoy on Youth, WHO Director General's Special Envoy on COVID-19 Preparedness and Response, Dr. Mohammed Abad, my young colleagues from the Association of Medical, Dental and Pharmaceutical Students, and dear colleagues from the regional office, country offices, and any other offices that are joining us in today's meeting. I would like to welcome you all to this webinar on youth engagement in COVID-19 response. And I'm also very pleased to join you today. Unfortunately, as Wasaq mentioned, I need to leave for another important meeting, so I'll be with you for some time, and I apologize for leaving this important meeting. Colleagues, the pandemic has impacted us all, irrespective of social or economic circumstances and age. It affected age groups with underlying health conditions, as well as young people. In addition to the possible impact on the mental and physical health, it disrupted the education and social participation of youth. This has been quite a challenging experience, especially to adolescents. In our region, which has one of the youngest population of any world region, young people were already facing conflict, civil unrest, and unfavorable socio-economic conditions before the pandemic. It has only added to the complexities and challenges in their lives. In spite of the various difficult socio-economic conditions and other conflicts and security issues faced, I am surprised to see how many young people are responding to the pandemic with optimism and creativity, promoting new ways of engagement and finding innovative solutions to the problem, which is expected to me. There is nothing new, but I am really surprised about the amount of such things that I have just mentioned. We will hear together some of their stories in this webinar. Colleagues, as the pandemic responders at UN government level, UN and government levels. Support is required from everyone to achieve an effective response. Young people are a special asset and they have several crucial roles to play. Young people with medical background can help overstretched health systems at this time of unprecedented high demand on health facilities. Another critical task is combating the COVID-19 infodemic. And I'm sure, colleagues, you all have gone through what has been disseminated in different channels of media, either social medias or official, non-official medias, about the disease itself at the beginning of the pandemic, in terms of its origin, in terms of its nature, in terms of its diagnosis, its management. Nowadays, the infodemic has moved, with a very clear information about the disease itself. It moved or shifted from the virus itself or the disease itself into, as you all know and as you all seen, attacking sometimes countries, sometimes healthcare systems, and nowadays commonly UN agencies, including WHO at the front line. Young people with their social media skills, peer network, social connections can help us fight this parallel pandemic of fear, misinformation, and anxiety among families, friends, and communities. Important as our countries start opening up, increasing the need to inform communities and promote preventive behaviors. So to my young colleagues here today, I say, please come forward. This is a unique time to demonstrate your spirit. Your communities, societies, and governments need you. Volunteer to help older adults in your communities. You can contribute by helping vulnerable groups or by assisting young ones at home and adolescents in their education. As the pandemic response, let me assure you that we will provide all the support you need to make your contribution meaningful. Tell us what you need. Training, advocacy, tools, advice, or whatever else may help you to help others. Today's webinar is an important opportunity for you and us to listen to each other and plan the way forward. Colleagues, this pandemic is a defining moment for our nations. Your assistance and strong support and actions and commitment are required in these challenging times. This is not only to ensure fast recovery, but also to have a better future for us, for you, and for the future generations. Let us join hands together to build a better future, as I said, for you mainly, but for us as well, and for the future generations. I wish you a very productive exchange of ideas and very fruitful meeting. And thank you very much, Wasik, Dr. Maha, and colleagues for arranging this meeting and giving me the chance to join you. Thank you.
Inspiring note and a call for action to our young people. Now, we will move ahead with our first panel of young speakers, and they are going to share what they are already doing and how they are already contributing this pandemic response. For this panel, we have three wonderful colleagues joining from three different countries. The first speaker is Amar Hamami, and Amar Hamani is representing the International Federation of Medical Students Association, the Eastern Mediterranean chapter. Amar, the floor is yours.
Thank you, Dr. Wasif. Hello, everyone. My name is Ahmad Hamani, and I'm the Regional Director for IFMSA in the Eastern Mediterranean region. I have a few slides to present. However, I still cannot share my screen. Okay, perfect.
Please, please, Wasik, someone has to mute Wasik.
Okay.
There's an echo.
I think it's fixed by now. Yes. So if you can hear me, I'll start. As I said before, as said before by Dr. Wasif, we'll be presenting case studies about how youth handle the COVID-19 pandemic. My case study will be about our members in Lebanon, which are the Lebanese Medical Students International Committee, and I'll be presenting hereby their efforts to tackle the COVID-19 pandemic nationally. So about GAMSEC, it is a national member organization in IFMSA that was founded in 1964 with more than 500 members as medical students across 6 universities in Lebanon. You can find details about all the initiatives and all their wonderful work in their website, gamseclb.org. So as soon as the pandemic hit, they started by devising a national action plan and response plan. It had 4 chapters in it, mainly, which were capacity, volunteering, awareness, and advocacy. For the capacity building part, they started by having trainings delivered by jointly with WHO Lebanon as well as the Lebanese Red Cross to healthcare actors. These the basics of COVID-19, proper protective measures, guidelines, procedures, and awareness. They also deliver trainings for medical students in cooperation with the Lebanese Red Cross and the Lebanese Pharmaceutical Students Association. These trainings tackled the same topics and were aimed to mobilize students massively on the ground to conduct actions for spreading awareness amongst university students, other medical students, staff, schools with all levels, municipalities, etc. They also collaborated with UNFPA to train the social workers. More than 350 social community workers were trained by medical students in collaboration with UNFPA in Lebanon. They volunteered in the border as over 65 medical students were trained on how to volunteer for doing border surveillance and patrol and detecting the cases before they enter the countries. And they volunteered in call centers as well. The main mission that medical students had was to follow up with the home quarantine people, as well as providing information for all the people who were calling to know about the COVID-19. In total, they handled a huge number of calls. The numbers that I have been communicated were that in 200, in two Ministry of Public Health call centers, they handled over 10 hours of call per day with 15 weeks and over 150 volunteers. In other call centers, mainly hospital call centers, they had a total of 4 weeks with over 90 hours of call handled by the students there. So they also were responsible for spreading awareness nationally with creating booklets with the various and multiple national stakeholders in the area, UNICEF, LRC, MOPH, Ministry of Higher Education as well, Disaster Risk Management and UNSCR. They also had national media outlet appearances in order to spread awareness that covered the entire country of Lebanon, hosted webinars on several topics, mainly being the basics of COVID-19, but also covering the mental health part, the SRHR, refugees, with over 17.6 thousand, with 17,600 reach. They also created social media awareness videos, and this is also a very nice idea where GAMSEC volunteers created a call in their social media pages, over 100 volunteers, and then they gathered all the questions and created an online campaign, frequently asked questions for anyone. They also have been performing advocacy on the national level by creating an e-learning manual that they used to advocate with the universities in order to have a proper transition, in order to be able to flatten the curve as much as possible. And lastly, but not least, they had a weekly newsletter, which was also in collaboration with several actors. And I can leave you with a quote here that was said by WHO Lebanon representatives that GAMSEC's work is a testament to the power of youth in the fight against COVID-19. So in the end, they gathered everything that they have been doing in a national response booklet that they shared with all our members in IFMSA and other listening organizations as well. These kind of booklets inspired other student organizations and other youth organizations to also create their own national response plans. There are a few, so from this case study, we can learn a few lessons. First of all, investing in youth and collaborating with them always builds back. Youth organizations are key stakeholders in emergency response strategies. Youth are innovative, passionate, and committed to take action. It is imminent to collaborate with youth-led organizations and promote youth-led initiatives for a grassroots impact within communities. And this is everything from my side. Thank you. Hello.
Thank you, Ahmed. I think Wasik, we should move now to Amira Ryan Abdelhadi. Is she moving automatically or someone is introducing her?
Sorry, Wasak, we cannot hear you, so maybe you need to speak by microphone.
Okay. So, can you hear me now? Okay, amazing. So my name is Ryan Abdelhadi, and I am the chairperson of IPSF EMRO. And I am here today to present to you a case study about our organization from Egypt. In the midst of pandemic health emergency, where a centrity takes over the communities, engaging the youth is the epicenter. Our case study is around our member organization, IPSF Egypt, and the incredible efforts to mobilizing communities. Since the beginning of the pandemic, they acknowledged the power of their human resources and committed to mobilizing their 34 local associations to establish a well-structured and efficient national response. The plan addressed three main aspects: awareness, policy and networking, as well as capacity building. Regarding policy and networking, EPSF signed a cooperative protocol with National Population Council, UNICEF, INSA, IADS and IFMSA Egypt to serve as international and interprofessional collaboration between Egyptian youth of health and medical backgrounds to tackle COVID-19. More collaboration with youth organizations also took place, such as IADS, IFMSA Egypt, and YP Egypt. Alongside the Ministry of Health, efforts were made to fight off the scourge of epidemic through running surveys to spot the most popular misinformation and respond accordingly. This was done via a set of activities and publications to dispel myths and raise awareness through digital channels and platforms. More than 15 SoundCloud emissions were made with a reach of 17,000 plays. 12 webinars and panel discussions have been organized and covered a wide range of topics, such as ethics, drug interactions, pregnancy and COVID-19, as well as other themes the pandemic shed the light on, for instance, mental health and domestic violence. Around 500 social media activities were established, such as posts, quizzes and challenges, workout videos, and many other initiatives with the sole goal of spreading awareness. Our members' efforts were not limited to only but also extended to reach individuals from rural areas and universities, where 10 cities around Egypt have been reached and sensitized with a donation of 700 hydroalcoholic gels, 30,000 masks, and 100 liters of alcohol. Since the beginning of the outbreak, 4,300 members have been empowered to play a key role in COVID-19 response by being awareness advocates, with a total reach of 733,000 sensitized individuals by far. EPSF Egypt committed to also address the collateral challenges the pandemic has brought on pharmacy students, including e-learning struggles and limitation, through providing more than 93 educational sessions to pharmacy students. The case study is the living proof that youth can lead the way with community mobilization and advocacy and be effective partners in COVID-19 response. Governments and stakeholders should partner with youth, treat them as equals, and engage them meaningfully in high-profile meetings as well as policy-making process. Thank you.
Thank you very much, Ryan. Thank you for highlighting the wonderful contribution that pharmaceutical students are making to COVID response in Egypt. We will move to our last speaker of this panel, Mr. Ali. Mr. Ali is representing the Association of Dental Students, and he's going to present a case study of Iraq. Ali, the floor is yours.
in this pandemic. So we will present the response that Iraqi Dental Students Association doing based on problem. Like we studied the problem of the community nowadays. It's having two issues. The first one is the lack of reliable information from for the local community, especially when they follow up the social media and their platforms, and of course the myth and the fake treatment plans all over the internet. So this is creating a new problem because everyone is trying different aspects of treatment, and they go to try whatever they see. So there is a lot of organization. We noticed that a lot of organizations doing the activities of going to the offline activities, but we want to do use the partnerships that we have in the country, and then we go to link them together to find a tech solution. And that's what the Iraqi Dental Students Association comes up with a website, a platform for the public, and with partnerships between Iraqi Dental Students Association, UNDP Accelerator Labs, which is responsible for enhancing local innovation, and local web developers too, to create the local platforms that gives a reliable information. And the features of this website is going to be giving you the pandemic map in the country, and it gives you more like the reliable awareness and guidance on how to act on pandemic, and of course the hospitals contact information, and the symptoms simulation game, which you can enter and find out if you have any symptoms and everything. So this creating new partnerships between different organizations in the country, which wants to go to health. And if youth get the chance to advocate for other organizations, which is high-level organizations, to advocate for using their materials, using the tech, using the partnerships to get more health information to the public with the new tools, with the new aspects, we can do that. And this is the proof of the power of youth and involvement. This website is not coming just for dental students. It is accumulative efforts, but it was driven by the information that we have. What is the next step that we will do? We are planning to go to form an alliance in Iraq to design new policies for activities after the pandemic, and collect information and insight from dental students to build new practicing methods based on evidence and research. And of course, we want to adopt the online learning as part from the education. This is our case study, and my message to all the youth and the webinar, and whoever like the youth will see this, this is the opportunity, and this is the start the collaboration between high-level organizations and youth. So you need to speak up your ideas, you need to embrace the local solutions and the local innovation. Thank you.
Sharing your work. The next panel is a group of seniors, leaders who are at the front line of national response in different countries, and also in one case, regional response. And Dr. Maha Ladavi, the Director for Healthier Populations Division here in WHO Regional Office, is going to moderate this seniors panel. So Dr. Maha, the floor is yours.
Thank you very much, Wasik, and thank you all the presenters in the last panel. Really very interesting, and a variety of experiences that show how young people are actually leading for the new world that we're going to have after, inshallah, we get this COVID-19 issue is is winning or disappearing, I hope. But definitely we are in a new setting and we need to think differently. And I like the online, the community-based, academic-based, all of these experiences. So now I would like to introduce Professor Dr. Mohammed Abad, who's a former Minister of Health and Population in Egypt, also former head of Department of Public Health in Cairo University, the largest university in Egypt, as well as the special envoy for the Director General of WHO on COVID-19 for preparedness and response. Dr. Mohammed Abad, I invite you to tell us, to give us some remarks on what you have heard and also some recommendations for moving forward. Thank you so much to have you. Thank you.
Dr. Wasek for the invitation, and it gives me great pleasure.
Yes, we hear you and we see you. Thank you. Yeah, we hear you loud and clear.
Yes? Okay, so great pleasure to. Okay. Webinar, and it's always really inspiring. As learn from their hidden, okay, to serve, engage, educate, communicate, innovate, empower, and lead. So filling the gaps and driving and rising to the challenges. You young people, you've driven the change and are driving the change in on the path. So we will have a better opportunity and all the dynamic, organized power of the young people affecting it in the different sectors. So the young people, the medical background, the health background, from what the experiences in the different countries, you have stepped up to support the health systems and the urgent needs through the collaborative, the organized work, coordinated partnerships with the different stakeholders. To formalize those community empowerment activities with research, communication, innovation, all of those things. Above all is the partnerships with the leading organizations to support the work on the ground and facilitate transfer. So what is support the practices, the detection at different levels and different. So we know that the at the moment, and we're going to see it, unfortunately, in the future. Now we understand that we will all views ahead. Every time we're asking the governments, we're asking the community, the state as the virus is ambiguous itself. So we're asking them, take care. In a while, we have to revert and adapt to the new normal. And this is where I hope, and I'm suggesting that you young youth and the young adults, particularly those with a medical background, the physicians, the dentists, pharmacists, nurses, and more, I'm asking, and I see you as stepping up and leading as change agents to support the adaptive changes, the new public health challenges that we are all going to face in the nearer future, and then we are facing. So in a way, to step up both at the front line, as you are doing, but as well as change agents among your peers through peers education and within the communities themselves in order to support and to lead the adaptive change that we are all hoping to reach and to be able to accommodate in our lives. So it is the time, I'm seeing it as this is the time for the youth to leverage all what you know, your values, your volunteerism, your activities, your innovative technology and your innovative ways to demonstrate the adaptive leadership that is needed during this time. Reaching out, supporting the process of adaptation and adapting and leading the change that is needed in light of this new normal. Applying the needed paradigm shift and proactively challenging the way people are acting, understanding, and in a way translating the new norm according to their context, which might or might not be the way that public health people or those who are really challenged by the situation of the COVID-19 are viewing it to support the response and the containment of the disease. So we need to proactively challenge the norm and the dynamics. And of course, this would require, first of all, your empowerment and empowering your actions and your engagement through the coordinated and collaborative work, plus the partnerships which are needed in order to put forward the innovative ideas and utilize your updated tools and platforms with the goal of creating sustainable solutions for the peers, for the communities at large, for the vulnerable groups at risk. So with the different tools that you have, different platforms, the different partnerships, we all are seeing it in a way. Definitely at some point, there should be some sort of assessment of your collective work on the ground and how it could be modified in ways and using innovative tools that would reach out to people in order to support them and to help them, even as as a way of understanding the communities, reaching out to them,
Dr. Maha,
keeping an eye on the changes that are needed. I finished?
Yes, thank you so much.
Okay, thank you. I wanted to say one more thing, but it's okay. So thank you very much, and over to you.
Thank you so much, Dr. Maha. And I think you've mentioned two very important issues. That yes, this is time when youth are the leading as agents of change, and also that there is a new normal and that the youth are the most adapted people to be able to lead on this. Let's go to our next speaker. Our next speaker is Dr. Akiru Saita, who is WHO. Actually, he works for the United Nations Relief and Works Agency, which is UNRWA, as we all know it, and he is the director of health, and he has a lot of experience involving young people in UNRWA, especially working with Palestinian refugees in Jordan, Lebanon, Palestine, and Syria. So Dr. Akiru Saita, I hope you're online, and please, you have 3 to maximum 4 minutes, please. I would like to start your intervention. Thank you so much. Dr. Saita, are you on? Is UNRWA online? What's up from your side? Can you check?
Dr. Maha, we can go to next speaker.
Our own WHO friend and colleague, Dr. Adham Ismail. Dr. Adham is our representative in Iraq. He has a lot of experience also working with young people and a lot of case studies in Iraq, especially working with COVID-19. We've also seen in the presentation from the young dental associations, also from Iraq, a presentation. So we hope we can link this together. Dr. Adham, please.
Thank you, Dr. Maha, for the introduction. And I believe I have 5 minutes, right?
Well, Well, now we can give you 5. You actually have only 4 minutes.
I had only 4, yeah. Okay.
Dr. Sifa was not online, maybe yes.
Absolutely. If I may share the screen, Ahmed, allow me to share the screen, please. Ahmed IT, Ahmed Abdulwahab. Ahmed Abdulwahab.
You have the floor now. You can share whatever you want.
Thank you. Thank you. Okay, I will go very quickly to the COVID-19 and the response that we have in Iraq here. As you all know, the implementation of the guidelines and standards from headquarters and regional office falls into one of the countries. And one of the countries, big countries in this region is Iraq, a country with 40 million people. And in our assessment, the country has a lot of potential resources, but has been, in some difficult situations over the last years. This has made our response is quite different, actually, than most of the responses that you would see. I will just display this slide for you to see that our response to the COVID-19 in Iraq was built mainly on a very defensive strategy, showing that we tried to flatten the curve. At the very first incident that happened, we had a choice that instead of leaving the curve, we should take some preventive measures, trying to delay that curve and flatten it so that the health system capacity takes us some time to build it and improve it. And in doing that, we have supported the government by logistics, by technical advice, and by many, many other things that we try to do. This is one of the things and one of our products that I want to show to you, which is our dashboard. The dashboard displays everything that's happening in Iraq right now, from the daily number of confirmed cases to active cases to cured. And it's so dynamic. When you press one governorate, it only shows you or displays the number for that governorate alone, like here for Anbar. And it has 16 different pages of information for all of you who are specialists, starting from the distribution of cases, the epidemiological curve, the incidence rates, and also for those of you, I'll display something very because of our colleague from Iraq who said that there's very few data on dental and healthcare professionals. This is a graph showing the number of healthcare professionals, for example, that has been affected by servicing the people and having so almost 1,000 physicians has been confirmed as active or has been infected. Out of the 15,000 in the country, 636 right now are being hospitalized, 7 died and 370 were cured. And this is their distribution. And also, if you can see that most of them, many of them are young age, like your good selves, the physicians themselves. Almost 205 are females and 191 are males, but none of them has died. The only death is for someone, for people over 60, which is what we consider as high-risk groups. And if you go on, there are many pages that also displays the infections by districts, by governorates, by age, by sex. We put all of this in front of the minister and the people who takes the decisions, and we consult with them to finally take some decisions like the ones that you've been hearing about, like lockdown decisions, closing borders, active surveillance, where to do the active surveillance, contact tracing, and many other measures that we are using. So this COVID-19, as you all know, is all about preventive measures, and countries that did well did good preventive measures. At the beginning, Iraq was so good in the first preventive measure that the first wave of infections have passed in an excellent way. People relaxed during Ramadan and Eid. This caused a higher infection right now, second wave, which we are trying to control. So hopefully with the current lockdown, we will be able to do so. I will stop here and give the floor to Dr. Maha. Over to you.
Many thanks, Dr. Adham. This was very, very good. And I liked what you said about the dentists in Iraq and the back to work and so on. I read this morning something very interesting. He said that we know that the pandemic is over when all the dentists are back to work normally. And I think this is important. Now I have toothache and I'm terrified to go to a dentist myself. So I think I'm waiting for that day when we can go back and have our dental care. So I want to thank the three panelists, the seniors as was a closer, but I know Akira is not here. I know I'm sure that something very.
Hello, do you hear me?
Oh, you're here. Thank you so much for coming. Okay, so now you can give us a brief, just a brief intervention, please, Dr. Sita, because, yeah. Please go ahead. Please
Thank you very much. Apology for the technicality. Greeting from yeah, do you hear me?
Yes, we hear you. Loud and clear. Yes. Go ahead, please.
Good, good. Okay, good. Yeah, thank you. So 4 minutes, yeah. I'm a great fan of the IFMSA and then that IPSF and IADF. Thank you very much. And the last several years, together with the IFMSA, we are making the very good meeting on the side of the World Health Assembly for the Palestine refugees. And we did it a webinar this year, and thank you really so much. I'm a great fan of this. We have a MOU with the IFMSA, and then we continue to have an internship, and I hope we resume this after COVID, and ready to have an intern from the IPFS and the IADF and the UNRWA, which we have 141 health centers to run. And then COVID-19 is of course a public health crisis, but it's more importantly that it's an entire society or human rights crisis or the human being crisis. And it unveils lots of all existing vulnerability of the communities. And I really appreciate 3 presentations, and I really hope I want that we work together to address the vulnerability of the society. That is what we are learning through the COVID-19. And then, as the SDG said, that we leave no one behind. And to make sure to leave no one behind, it's very important that we stand and to stay with those who are vulnerable. And I think the Iraqi and Egypt, thank you very much for the previous speakers. For example, in Lebanon, that we have a Palestinian refugees who have a trouble in accessing COVID-19 care. And you know very well that we have one building with a Bangladesh immigrant workers of more than 70 infected. That kind of thing is unveiling that in the society. So that my plea to the youth people, continue to work together. And then that as a failing adults, that my hope that you continue to show the solidarity to those who are suffering the most, and they raise their voices to the vulnerable, because that's the one who always suffer and the first suffer. And so that kind of youth voice is very important, and also that it's important for the youth to raise their voices. I'm quite sure that many youth are so much worried about their futures. Many of them lost their jobs. Many of them lost education opportunities, and they maybe lost their aspiration or the hope for the future. I think in that sense, medical area associations for the doctors, the pharmacists, the dentists are in a very good position because they have a highly skilled, talented people, and they are saving the life. Saving a life is most important things we have to do now. And the saving a life is not only medical. Saving a life is a societal, economical, and everything cultural. So that I really would like to see working together for the young people, for your power, and most importantly to me is the anger. What is happening now in the world is totally not acceptable to many instances, like demonstrations throughout the world, and also what's happening in Yemen, people dying without any reasons, is absolutely not acceptable. I think it's very important for us to address our anger and translate into solidarity and make it aspiration for the rest of the world. Thank you very much.
Thank you, Dr. Sita. Excellent as usual. Really thanks for the 3 presenters and for your insights on what was presented. I'm going to be very brief, actually, because already we've been running out of time. But I just want to mention a couple of points. Number one, I think you have all seen how much we are all involved and like to be more involved with younger people, but not only to be involved, but also we want young people to lead the scene. We want your voices to be heard, but we also want you not only to raise your voices, but to raise them very high and to take us with you, because you are more capable of fighting for the rights of the vulnerable. You are more capable of showing solidarity and good work, and you are much more innovative, and you can work together in a much better and healthier way and to move us forward. Thank you all, and I move now to the second session, which is led by our dear colleague and friend, Dr. Batul Wahdani. So nice to see you, Batul, on the video. So it's in your hands now. Please take over.
Thank you, Dr. Maha, and I'm very happy and very proud to hear the actions of my colleagues from student organizations and the work that they have been doing during this pandemic. And to be honest, I cannot say that I'm shocked from hearing these examples, because coming from this background, I can assure you that this is a very small fraction of the work that they have been doing throughout all the past years, and the work that they do on everyday basis, not just only during the pandemic. Of course, they have amplified their efforts, which is a great step to support the community during these hard times. But it is also important to acknowledge that this pandemic is an opportunity that we can utilize to fill the cracks of our health systems. We have seen the great pressure that was imposed on the health workforce worldwide, and especially in our region. Students and early career professionals were pushed to the labor market and were forced to work under indecent working conditions with unpaid work. And of course, voluntary work is very important to support our structures, but as well, we need to amplify and scale up the health workforce to be able to avoid such situations in the future. So this is an opportunity to focus on building a stronger health workforce and having all the leading youth organizations and health organizations present with us. This is something that we need to think forward for and invest in during this time and for the future to avoid such situations. Not to take more time, this is actually the time that we can use to hear from other people who have joined us, and it's very inspiring to see that we have 138 people with us in the webinar. So we're going to have a period of short interventions from anyone who would like to speak. This is your chance. There are two ways that you can do that. You can either wave through the, you can choose to wave your hand through the call, or you can send us on the chat your question, and we would really appreciate if you tell us who you're directing your question for, so we can avoid lagging in time. Please make your interventions very brief, 1 minute maximum, because we have very limited time. And I'm going to start with Arouj Jalal.
Hi, good afternoon, everyone. Can you hear me?
Yes.
Hi. So I have a question for Dr. Sita, if I may. I was just wondering about how if they have or they are planning to involve young population of refugees in the COVID response, since they're already a particularly vulnerable group of people who are facing many challenges in terms of education and employment as well. So I would just like to hear his thoughts about that.
Sorry, should I answer or what?
Yes, if you can.
Hello, Batu, how are you? Where are you? So the answer is, I think it's good that we will find the answer together. I think I have something in my mind, but I'm older than your parents, I guess. And then that you should not listen to me. You should listen to your voice. You should listen to your people. And you tell me that Zeta, you are stupid, but you have to do this, and I'll do it. I think that's very important. In the COVID-19, the world is quite different. And we start, I think, particularly when we work with the youth, that we start bottom up. You tell us what is missing in the community, what is missing in the youth, what is help we need as a community, and then we can start from there. Sorry, I'm not answering to your question, but answering to your question. Over.
Okay. Thank you, Dr. Sita. We'll have another intervention from Ahmed Mustafa. Are you with us, Ahmed? Okay, so maybe until Ahmed responds, we can move to.
Can you hear me?
Yeah, we can hear you.
Okay, greetings, most honorable gathering. Thank you for having me in such a bewildering webinar. And on behalf of MSA and WHO, I strongly agree and reinforce on the decision having the youth to contribute in such case. Since the youth possess a huge amount of power and willing to contribute in diminishing the spread of this pandemic, having such a significant amount of energy, we conducted awareness campaigns in variable areas to boost the awareness on the protection from the pandemic. And we also conducted awareness campaigns in all social media platforms, so it can reach every and each individual, until we figured out that people who get approached by these traditional approaches end up not perceiving the whole idea. So we had an idea to make videos, short stories, to engage people's minds and be always recalled by them. Yet, in the future, we hope to have sustained conferences in the Eastern Mediterranean Regional Office to ensure the engagement of the youth in the future dilemmas. Thank you, Honorable Gathering, and thank you.
Thank you, Ahmed. And now we can hear from IPSF Algeria.
Hello, can you hear me?
Yes.
I think I can go straight on. I would like to share our what has been our activity in ASEPA Algeria. So ASEPA Algeria is a full member in IPSF, and we represent 600 pharma students. Much efforts were actually done by our members to lead the COVID-19 response, whether through advocacy, charity, or awareness. As part of our response, we held around 11 webinars, an offline awareness campaign, and various online activities and publications, which managed to reach more than 230,000 individuals. Yet, what I believe ASEPA Algeria brought to the table is being the voice of professionals in a way that is heard and understood by youth. We had 22 radio passages in total in the 3 languages spoken in Algeria, so in French, Arabic, and Berber. We also had 8 TV appearances and 6 articles that were published through national press, all while ensuring that the message is well received by our peers. We've also provided assistance to the White Army during Ramadan, where we served more than 160 iftar meals through 8 different hospitals, and we donated more than 630 hydroalcoholic gels, gloves, and other equipments. One last thing that we believe is important is COVID-19 and the environment, which we try to address through initiating the Green Challenge that focuses on waste control and regulation. Thank you very much.
Thank you so much. And we can hear now from Abdullah, President of NAMS Yemen. Are you with us, Abdullah? Okay. Yes. Okay. So in order to save time, we can move to Omar from Lebanon. Omar Abdul Hassan.
Hello, can you hear me, guys? Okay. So, hello again. My name is Omar Abdul Hassan. I'm currently a 6th-year senior medical student at BAU from Lebanon. First of all, I would like to thank our moderator and former president, Batul Al-Wahdani, for giving us the floor. And I would like to share with you the following statement. On February 21st, 2020, Lebanon's first case of COVID-19 was officially declared. A wave of panic and fear over the country, the nation worldwide. But little did they know that one case was enough to set the spark of change to the life we all knew. February 21st, 1 week apart from one of the biggest events on IFMSA's timeline, the March Meeting General Assembly in Rwanda. Our delegation faced one of the toughest decisions to be made, to attend or not to attend. And after several discussions and based on the recommendations of the WHO office in Lebanon and our Ministry of Public Health, we decided to put our personal benefits aside and canceled our attendance 3 hours prior to our flight. The decision was not easy, knowing the impact it has on our organization. But in such a situation, we realized that nothing will be more important than the health of our family, friends, and most importantly, our community. Nevertheless, we took that moment with all its negativity and decided to convert it into an actual force, aiming to help in our country's response against,
Omar, can you keep it brief because we have very short. Yeah.
Of course, yeah, I'm reaching the end. Okay, so with the continuous trust of our ministries and WHO office in our country, LEMSIC's engagement in the defense grew by the day, and as well as our sense of responsibility. As the situation became more serious, we felt that medical students can play a huge role as part of Lebanon's healthcare system to fight against this pandemic. Based on the previously mentioned points, I hereby address all of you here, public health leaders, ministers, and healthcare workers, to trust in your youth and invest in their energy because they can surprise you with what they have to offer for their respective communities. It is in such situations that our youth have to be engaged, or it is such situations that provide them with challenges and opportunities to come forth with their ideas in order to ultimately grow and improve. Do not cast them aside and mistake their humble experiences for incompetence or underestimate their sense of responsibility. The youth are the future, but change is born in the present. So allow them to take part in it and help them starting today to build a better tomorrow. In the end, I'm Omar again. I'm the president of LEMSIC, Lebanon. I would like to thank the WHO office in Lebanon, our Ministry of Public Health, UNFPA, and everyone who supported and is still supporting our work. And thank you for listening.
Thank you, Omar. And we can now have Mamdouh from Egypt.
Yes.
Please keep it brief. Yeah.
I'm really pleased to be in this fascinating meeting. Now, we are all pleased to hear that our young colleagues have been trained and they are now able to help with this pandemic. Now, not just young people, and we should not treat them like that. They are young health care providers. Now, the health system in most of the countries are extremely exhausted. And we need to find a mechanism of utilizing the skills of our trained young colleagues to share in enhancing the capability of the public health systems in our Arab world. They can be very useful, and we can use of their talents as young people and knowledge as young healthcare providers. One of the suggestions is that they can work as an outreach healthcare providers. As we know, young old people who get sick, they are left alone at home, and the family, they just put the food at their door and leave them alone. That's where our young colleagues can be of great help, I think. Thank you.
Thank you, Mamdouh. We can now move to Abdullah from NMS Yemen. Abdullah, are you with us?
You hear me now?
Yeah.
Sorry for that. From Hadramaut, Yemen, we send you our greetings, and it is our pleasure to be here with you in the high-level webinar. NMS Yemen would like to emphasize the collaboration between the government and organization at the national and international level. This is important to achieve our main goal is universal health coverage and general, and nowadays to fighting and to stop against COVID-19. The National Association of Medical Students in Yemen launching an online campaign called God Bidar, it meaning stay at home in English, to raise the awareness on COVID-19 since March. And this is enrolled under the IFMSA program, thus gives the international recognition by the IFMSA. This campaign successfully reached to the hundreds of thousands of Yemeni people that affect directly to their behavior and encouraging them to adhere with the protective measures limiting the spread of the virus. As you know, Yemen suffering from difficult situations and hard situations, starting from wars and destructions and different epidemics and disease. And nowadays we have coronavirus, which started at the 10th of April. Until now, the number of cases is increasing, and the situation is getting worse day after day. To Dr. Ahmed Al-Mandari, the WHO, and to all the international organization, let me here send you a message from our health sector that they send you an urgent needs to support by PPE for our staff and to increase the clinical capacity for hospitals, and also to provide us with the important things to that's the solution and the medical nasopharyngeal swab to detect the cases in the early stages. And here it's a chance to thanks engineer Sheikh Abdullah Ahmed Bukshan for high support to all campaign that help people in Yemen. Thank you for all, and thank you for this space to have this statement.
Thank you, Abdullah. We have a question from Sonny. Sonny, would you like to say your question? Or would you like me to read it? Are you with us? Okay, so I can read it to save time. So the question reads as, is there a more need to make more policies for youth associations betterments as youth are part of corona fighters by supporting healthcare systems? So is there? So I think the question aims to ask is there a need to scale up youth policies at local level to support youth action during such emergencies time? Would anyone from the panelists like to respond to that? Dr. Maha, would you like to speak about how WHO EMRO are trying to scale up youth action at local level through the country offices?
Action with young people?
Yes.
We are with inviting young people to join. I think here I noticed a little bit of misconception. It's not only about we inviting young people. It is very much about young people wanting to be involved and coming to us and asking for the resources that they need. And I'm not talking about technical support. I'm talking about connections and networks and so on. This, we can do a lot of that, all what we need. And I think, Batul, you have seen by yourself and your colleagues who have been working with us have seen over the past maybe couple of years, even before the pandemic. Our department is very much, and the WHO EMRO in general is very much trying to give leadership to young people to lead on the issues that are most important, not only because everybody's talking about the importance of involving young people. No, because we believe that the young people are the present, the future, and they also they are the ones who are going to bring all the future generations. So they're connecting to all the possible generations. They have very positive effect on the older people as well as on the younger people. They're the ones who are going to change all the concepts, and we hope this. All the speakers talked about a new way of thinking, a new world after the pandemic. It's important that grasping the ideas of new modalities, of new approaches, of how we can move not only health forward, but also the economies and the society as a whole and all the social networks forward, it will come from innovative ideas of the young people. So we are here to, we want to work with you. We want you to invite us to work with you. We want you to feel empowered enough to be able to reach out. We are going to hear shortly from the youth envoy of the UN. I think she will come usually. Every time I listen to her, I'm quite inspired, really. And I think she will put a lot of issues on the tables and probably recommendations that we all should follow on. But just think of it, we are one society, different age groups, but there is one age group, which is the young people who can actually lead, and we fully support that, fully understand it, and fully want to follow your leadership.
Thank you so much, Dr. Maha. And we can have an intervention from Ahmed from Egypt.
Yes, thank you, Batul, for this chance. And really, as a youth nurses specifically, we highly appreciate the importance of multidisciplinary approach. And we are believing that we are one healthcare team, especially in response and standing against COVID-19. I just want to thank more than 50% of healthcare system, they are nurses. And according to the State of World Nurses International Report, which has been published by International Council of Nurses and World Health Organization, nurses are representing more than 50% of healthcare. Really, we need to highly appreciate all the multidisciplinary team and especially nurses. And I will let Mr. Hassan Khalid from Sudan to speak more about nursing intervention and actions that we already done in the Eastern Mediterranean region and all over the world. Thank you, Batul, and thank you for all the attendance and plenary. Thanks.
Thank you, Ahmed. And we'll hear from Hassan Khalid during the statements of the organizations in the next segment. But unfortunately, I know a lot of people would like to speak, but due to the time limit, so we can finish on time, we're going to move to the next part. And if we have time by the end of the webinar, we will get back to the discussions and the statements on behalf of local organizations. So thank you so much, everyone, for your interventions. It's very inspiring to hear these examples, and we're sure that there are plenty more other examples to outro from local places within our region. So now we can move to statements by youth organizations, so we can hear about the global aspect and their commitment towards scaling up youth action during the next period. We're going to start with Mr. Nibosha Nikolic from IFMSA President. Nibosha, would you like to speak? And please keep it very brief.
Yes, thank you, Batul. Hello, everyone. I'm Nibosha Nikolic from Serbia. I'm the president of IFMSA, and it's a pleasure to be here with you to speak shortly about our work and hear about all the initiatives presented here. At the center of our work lies the capacity building of our members, but also our ability to voice the opinions of young health leaders and global health enthusiasts. Facing the global spread of COVID-19, IFMSA is committed to using the skills, knowledge, and values that our members possess to tackle this pandemic. We aim to provide evidence-based knowledge and combat misinformation about the virus. Our website now has the COVID-19 response page that includes all of our activities, together with a resource center with many awareness and educational WHO and CDC materials in 7 different languages. We identified 170 fact-checking organizations and are now working with WHO and Amazon to create a fact-checking platform. IFMSA also organized webinars or participated in webinars with Dr. David Navarro, Jahat Navikimanayaki, UNICEF, WHO, Yango, and EMI, to name some, with the outreach of over 10,000. We developed and published with UNFPA and PRESI a series of interactive videos in multiple languages for COVID-19 and youth to take an active role in sharing information during this pandemic. These videos can also be recreated. Our members play a major role in our response. medical students in 35 of our member organizations conducted local activities addressing COVID-19 in 5 regions, collaborating with their own WHO country offices, UNFPA, among others. Our ultimate goal is to have these actions conducted in all 140 member organizations. As countries across the globe went into quarantine, medical schools have been highly affected by the current outbreak. The pandemic has put medical students worldwide away from the classes and clinical training. IFMSA is working closely with members so as to track the status of medical education during the pandemic and identify what alternative measures medical schools are taking to substitute the training they are missing. We created a map to share the global overview of the situation found on our website. Furthermore, we are constantly assessing our upcoming meetings based on recommendations by relevant governments and institutions in order to decide to hold them, postpone them, or cancel entirely while providing different methods to decision-making and capacity building. Finally, our Opus General Assembly meeting is currently planned to be organized online, during which we will be proposing to have a policy document adopted by IFMSA on health emergencies that will include call to action and commitments of IFMSA in such situations in the future. Thank you for having us speaking here.
IPSF President, Ms. Aya Jamal. Aya, would you like to speak?
Yes, thank you very much. Can I confirm if you can hear me?
Yes.
Okay, thank you everyone and good afternoon. And as usual, I'm really happy to be part of these discussions in this platform where we're speaking about the role of young professionals or youth in general. And I'm also happy that we passed the period of needing for more engagement, and now we're actually implementing and we're engaging the youth. So this is a good step forward. I'm speaking today on behalf of the International Pharmaceutical Student Federation, and it's worth mentioning that during the COVID-19 pandemic, it became increasingly apparent that as youth organization for future healthcare professional, IPSF was in a perfect stance to utilize its platform to educate, empower, and guide its members' efforts to take the lead in the COVID-19 response in their respective countries and contribute to the global effort to also flatten the curve. We have empowered and provided our members with a database of materials to help build their campaigns and encourage the proactive exchange of impactful ideas and successful initiatives between associations through establishing an open space for communication and reflection. Throughout 2 consecutive weeks, IPSF held the global COVID-19 campaign in collaboration with all its 5 regional offices to raise awareness on the impact of the pandemic globally, as well as to shed the light on the important topics related to the crisis, such as climate change, medication development, regulatory affairs, health impact, student-led initiatives, infodemics, economical impact, as well as post-pandemic era, and of course, never to forget AMR. We have collaborated also with our respective allied student healthcare professionals, which we believe that it's a critical role that we need to take at this time to ensure interprofessional collaboration and engagement with other organizations have a stronger stance and better. And also as drug experts, we also took the responsibility to collaborate with professional organizations like Fight the Fakes to raise awareness of falsified medicines and substandard healthcare products, which have come to light and prospered during. Additionally, of course, we are in close contact and collaboration with our professional partner, the International Pharmaceutical Federation. We've been organizing a series of educational webinars. And as the crisis continues, IPSF acknowledges the severity and immediate nature of the virus and commits to invest in its human resources and member organizations from the 92 countries worldwide to reduce the panic among the public and dispelling misinformation through empowering our members and guiding them to be effective partners in the global COVID-19 response. We would like also to mention that we are currently working on a policy intervention and a survey on the impact of COVID-19 on education. We have a wide shared survey that is yet to be shared with the public and with our members specifically to assess the impact of COVID on education, which is a major issue. At the end, we definitely commit to being the platform through which our members can collaborate, learn from each other, and to build well-structured initiatives and to keep on advocating for how to manage and how to tackle the issue of COVID-19 and the emergent diseases in general. We are planning an e-conference on COVID-19 as well that is yet to be shared. And we will continue providing opportunities for our members to be more engaged. At the end, I would also call for stronger engagement of the youth as usual, and for sure to be able to help with the combating process of this emerging disease. And thank you very much for the opportunity.
Okay, so it seems that it has been cut. We can move now to Mr. Ali Diab from IADS. And Ali, please try to keep it brief because we still have 2 statements to be delivered. So Ali, the floor is yours.
Thank you, Batul. I'm speaking on behalf of International Association of Dental Students, honorable guests, distinguished healthcare leaders. We represent 12 country members in Middle East and 73 worldwide, working all together for better oral health, youth participation, and linking dental students' projects and activities to the Sustainable Developmental Goals. As a youth healthcare professionals in this unprecedented time, we provide our full commitment and cooperation for WHO on national and regional level to tackle the pandemic of our lifetime, COVID-19, by enhancing social responsibility and awareness among the vulnerable communities and young peers. IADS calls upon WHO country missions to increase youth involvement in the planning, delivery, and design of COVID-19 programs, to build a local network of partnerships that supports the organization effort of doing more with less by embracing volunteerism and capacity building for future healthcare providers. The World Health Organizations hold a vital role in building the healthcare task force, and that starts from addressing the future local healthcare leaders beyond our headquarters to collect accurate local data contributes to our global efforts to address serious healthcare challenges through effective problem framing methodologies. IADS are deeply concerned about the dental clinical practice measures during and after the pandemic, as we encourage local stakeholders and health-related organizations to develop and sustain guidelines for practice and raise awareness about the possibility of COVID-19 transmissions through dental clinics. This webinar is a historic first step in the way of long-lasting collaboration. It is the least that we can do for the heroes in the front lines fighting against the virus. We urge local stakeholders to take realistic steps to build trustworthy relationship between young healthcare professionals and high-level organizations. Thank you.
Thank you, Ali. And now we can hear from Mr. Hassan Khalid on behalf of the nursing students associations in the region. He's the president of the Nursing Student Federation. So Hassan, are you with us?
Can you copy if you are hearing me?
Yes, we can hear you.
Dear Dr. Ahmed Al-Mandri, the WHO Eastern Mediterranean Region Director, dear the United Nations Director General Envoy on Youth, the Honorable Chairs and distinguished delegates, the novice and nursing students at the region of the Eastern Mediterranean strongly support and applaud the WHO and the other member states' efforts to fight COVID-19. As well, we thank you for recognizing the youth nursing and midwifery participation in such an event. We have been engaged actively in the fight against COVID-19 as novice and student nursing at the region by supporting the government's response, national risk communication systems, and leading the social and public media educational campaigns fighting the rumors and false data and news, domestic violence, and also we had participated in the patient's treatment activity in the isolation centers and hospitals, and even supporting logistically in some area by providing personal protective equipments and infection protection and control supplies and way more other items. But we're still concerned about the negative impact of the COVID-19 upon the nursing workforce. The numbers of the infected colleagues are high. The violence against the nursing workforce is still alarmingly increasing. The personal protective equipment is still low. And the lack of the nursing and midwifery leadership at the arena of the decision making is also another problem we have noticed at the region. We call upon the WHO regional officials and the IMRO member states governments to take an active role in fighting the infection among the health workforce and support the frontline workforce with the PPEs and infection control and protection supplies, controlling the violence at the workplace, and recognize the nursing and midwifery leadership role during this hard time. Build the capacities of the nursing workforce properly to fight COVID-19, as well as involving more young nurses and midwifery at the process of the decision-making regionally and nationwide. We also recommend the WHO and the regional governments to take an active and proactive measures to learn the best practices to fight and prevent any future similar crisis. Finally, as leaders from the youth nursing and midwifery at the region, we reaffirm the need for the interprofessional collaboration. As well, we are confirming our call for the global unity and solidarity to survive such a condition together. Thank you. Was Hassan Khalid from Sudan, representing the Eastern Mediterranean novice and nursing students.
Thank you so much, Hassan. And thank you everyone for the ones who shared their statements. And unfortunately, due to the time, we are not able to take statements from everyone who would like to speak. But you are more than welcome to share these statements and to post them as well, and to tag WHO EMRO and all the people who are present here, so we can amplify and outro youth actions at local level. Now I would like to give the floor to Dr. Maha. Dr. Maha.
Thank you very much, Batul, and thank you all those who have given the statements. Very well thought of statements and very constructive with excellent recommendations, and hopefully we'll be able to move on this together to be able to move forward. It is now really my pleasure to introduce our keynote speaker, Ms. Jayatma Wickramanayake, the UN Secretary General's Envoy on Youth. First, we're very happy that the UN Secretary General's Envoy on Youth is a young lady, which is pleasure to people who, like me, who actually look at the gender balance in the appointments of the Secretary General. Number two, she's a wonderful person. I have listened to her a lot, and really honored that she has accepted to be part of this panel. Ms. Jayatma was appointed as the UN Secretary General's Envoy on Youth in June of 2017, and she's the second one to take this position. In this role, Jayatma works to expand the UN's youth engagement and advocacy effort across all 4 pillars of work of sustainable development, human rights, peace and security, and humanitarian action, and serves as a representative and advisor to the Secretary General. I'm so happy that she is here with us. I saw her on the video earlier, and I'm pleased to invite her to share her views with us. Please, Ms. Jayatma, the floor is yours.
Thank you very much, Dr. Maha. And again, a big thank you for inviting me to this event and to join you and all the young people here, and to really spend the morning of my time here in New York really productively listening to all these very important case studies and stories that you mentioned. And I often don't get the opportunity to actually sit in a meeting and listen to other people's opinions. I'm often invited to speak first. So this was a unique experience for me as well. And I've learned so much. I've made a lot of notes in my notebook about the different experiences that these young people and WHO, by working with these young people, had. Even though I have a prepared keynote speech, I thought I will not go into that, but I'd rather try to kind of summarize and share with you what key takeaways that I gathered in this conversation today. And I think the first and foremost realization for me was that COVID-19 undoubtedly has impacted young people in so many ways, from not just on their health aspects, but also in terms of their education, their employment. Someone was talking about how an important meeting that was supposed to happen in Rwanda for youth organizations was cancelled. And a lot of the times, the ways that young people choose to connect with each other, communicate with each other, they have all been changed and in a very drastic way in a very short period of time. So I think one of the key things for me to take out from this conversation was also the resilience that young people have. We often look at young people as, you know, half citizens or adults in training that need our support, but really they are very resilient and they can adapt to situations very well, and they have proven this, and particularly young people in your region has proven this, despite of the many other issues that are there, from conflicts to food security issues to peace and security and humanitarian crises that you have in some of the countries in the region. So really kudos to that, and really admire your resilience and adaptability and flexibility in changing your priorities and really being good partners, not just for the UN and WHO, but for your communities and your families in this time of crisis. Particularly when I was listening to the first segment, when our friends shared experiences from Iraq, Lebanon, and Egypt, I think three things really came to my mind. The first one was that these young people, or medical students or dental students or young healthcare workers, they did not wait for an invitation. And as Dr. Maha said in her response to the last question, they didn't wait for an invitation. They didn't wait for the doors to be open. They took the initiative. And I think that's one of the most important things about, I think, a common thread that binds all these initiatives, that case studies you shared today. You took the initiative and you were proactive in identifying the issues in your community, in your country, in your sector, and trying to come up with the solutions. And the second piece of that is your leadership. So you were not waiting for somebody to tell you what to do when you identified the issue and took the initiative, but you really took leadership. You gathered your troops, you used social media, you used your youth organizations, you used your universities and student clubs and associations, and you really took leadership, which we also sometimes don't often see in our own elected political leaders. So very, very humbling to see how youth organizations from the communities have taken this type of leadership role. And thirdly, enthusiasm and your commitment to the cause. And by being medical students or students affiliated in the medical sector, I think all of you have a strong enthusiasm and commitment. And when the world was calling for support for a health crisis, you really stepped up and showed that you're committed and that you're passionate. So initiative, leadership, and enthusiasm and commitment, I think are some of the really strong qualities that I observed across these different cases you presented today. And the third point is that as we recover and rebuild from the COVID-19 crisis, and I know that certain countries are already starting that process, but some countries are still going through the response part of the crisis, and different countries are moving at different paces. But still, I think as young people, it's very important for us to also see what's next, that the COVID-19 crisis, its health impacts, but also its socio-economic impacts are going to be dire on this generation of young people, also exacerbated by issues like climate change and peace and security, changing demographics, and the new technologies that we are being presented with. And also with that comes a whole new plethora of challenges related to misinformation, hate speech, and the negative aspects of our connectivity and of social media. So I really encourage you to also think about, 2.0, what's next? You've done all of these amazing things, and how can you also bring these networks, these experiences, and this enthusiasm, this leadership into the post-pandemic recovery and rebuilding of your own countries, of the region, but also for the world as well, are very important. And then fourthly, how important it is, even this conversation you had this afternoon, to have intergenerational dialogue, how important it is in any sector, and you have proven this in your sector today. It is to have conversations with young people and seniors and adults and specialists and those who are have more experience than we do in that particular field, and have a dialogue as equal partners. So not attacking each other, not passing the blame to each other, not passing the responsibility, or not considering one is better than the other. You really had a good intergenerational conversation, and I think these are the types of conversations we need to have with mutual respect, and really identifying that, you know, no one generation alone will be able to find solutions. Young people won't be able to find solutions alone, and older people will not be able to find solutions alone. So how can we come together as intergenerational leaders to find solutions and make those solutions sustainable as well? So I really hope that WHO and IFMSA and other organizations, I'm sorry if I didn't mention any, who are involved, could also replicate this at the country level, and these type of dialogues at the community level as well, because this is really needed. And last but not least, I think, and there was a question about it as well, when I helped the Secretary General launch the youth strategy for the UN system, one of the things that we really made front and center is that the UN will no longer work for young people, but the UN will work with young people. So I hope that not only in your region, but also around the world, our UN country teams, our regional colleagues, our global colleagues will really see young people as equal partners, young medical students or young dental students or young healthcare workers or whoever you are, that you will be seen as equal partners, and that you will be partnered with as equal stakeholders in any process, if it is COVID or not. And if they don't, and if the UN doesn't do that, then I also encourage all the young people to hold the UN accountable for not treating you as equal partners. So with that, I want to wrap up and really appreciate all the work that has gone into this. Thank the regional director of WHO, Dr. Ahmed, and all the other, Dr. Maha and everybody else who participated. I've certainly learned a lot, and I look forward to supporting with you and being with you throughout this journey. Thank you very much.
Excellent, as usual. Thank you so much, Jatma. Really very inspiring keynote talk, and really you set up good criteria that I hope people will follow. First, I like the intergenerational dialogue and leadership. This is a very good idea, really. If you think about it, it's not about senior or older people leading. It's not about only young people leading. It's this intergenerational dialogue and leadership is going to make a lot of difference. You talked about resilience, you talked about flexibility, you talked about the role of young people in the community, you talked about the leadership, and I liked when you said your troops. So they take the troops, they have all these platforms to move forward and to move all of us forward. Enthusiasm, yes, you mentioned this. It's very important for the, this is what young people have, and they can inspire us also, like you have just done for us to move forward. And very happy to hear all about the plethora of challenges that you have mentioned, because this is something that we always have to keep in mind. We do have a lot of challenges, but with the intergenerational dialogue and leadership, I think we can pass this, and I think I'll be using this terminology, if you don't mind, in the future, and quote you on this. Thank you so much for your inspiring talk, and it's a pity we cannot give you a floor for questions because we're running out of time. But we move to the closing of this session. We invite Dr. Rana Haji, who's our Director of Program Management in WHO Eastern Mediterranean Regional Office. I know Dr. Rana is online, so it will give us some concluding remarks and feedback on the meeting today. So thank you so very much, Yatma, on behalf of all of us.
Hello.
So Rana, you're on. We hear you.
Great. You can hear me. Great.
Excellent.
And thank you, dear colleagues. I'm sorry I actually missed the first part of the meeting, which sounds like it also was the part where a lot of country experiences were shared, but I was at another meeting. Thank you again, Maha and everyone for organizing this. Very, very exciting, actually. Even the second half, I listened to all the statements and the presentation by Jatma, I think was very inspiring and actually kind of like the highlight of my day, actually, to hear all the young people and the energy. I mean, this intergenerational dialogue is very critical, but it makes us feel old. But that's great. This is the whole purpose of really having this dialogue and benefiting from the experience. I mean, I will try to be brief. I know you all have been on for a long time, but you took me back probably 30 years ago when I was a medical student at AUB during the civil war in Lebanon. And we had to be pulled very early on in medical school, actually, to emergency rooms to help dealing with some of the urgent care issues because of the limited capacity that existed in the country at the time. And that's, again, what we are facing with COVID. It's not just about the COVID response per se, but all the other essential services. Actually, the other meeting I was on, just because of that I missed the first part of this one, is meeting to look into how can we support countries to continue to do the essential health services, the immunizations, the maternal health services, the dental urgent care that you all have already mentioned, and this is, I think, having people like you, all the young health professionals, at this time, it's a great opportunity to support your countries. I'm really pleased to hear from colleagues. I heard colleagues speaking from all over, from places in our region where it's really tough, from Yemen, from Sudan, from everywhere, all of these countries, and very good to see this engagement by youth in health at all levels. The other thing I was very happy to hear, at least also the part that you're already way ahead of us, I have to say. I mean, you're already thinking about systems, that the reason the region is in such a difficult place is because we don't really have the systems in place for health that allow us to better respond to the pandemic per se, but also better deal with all the urgent health services. And I think this is really critical, that you already have that systems thinking, and you are really growing up professionally with this mentality. This is really important, and I encourage you to keep that in mind as you move on. If you look quickly, at some of our biggest challenges with the response has been lack of certain systems in place. We didn't have good surveillance systems. We didn't have good laboratory systems. We didn't have good infection control systems. Another very important discipline that I would encourage you to also keep in mind and to be advocates for that, because as unfortunately with all our very deep respect and appreciation for healthcare workers, we have lost many of them in the region because of the lack of good infection prevention and control systems. Some of you mentioned the importance of AMR. This is one way also how we prevent spread of AMR is through good IPC. Anyway, I mean, I can go on and on, but it was very encouraging for me to hear your perspectives, your deep understanding of some of the issues on the ground, and also your energy, your passion. Please keep that. We need it. We need it for the region. And some of you probably will do like me. I mean, after medical school, I left and went for 30 years to the US, but I came back to the region. And for those of you who would leave for whatever reason, professional, other reasons, please keep the region in your mind. I mean, this is a region that really needs all its young people. We need all of your capacities, all your energy, all your intellect, and there's a lot to be done here. Even though we have many countries right now suffering from not just pandemic, but many other conflicts and emergencies. Without your capacities, we're not going to be able to rebuild. And the dialogue now that is prevailing is about rebuilding and rebuilding better. Post-COVID, COVID will pass, inshallah. but it's going to change the way we do public health forever, most likely. It's going to change the way we think about strengthening systems. It's going to change the way we, we document and we implement things on the ground. It's going to change a lot of ways we do not just public health, but healthcare in general. If we want to rebuild, and we're going to rebuild people, we have to do it with our young people and our young professionals. So we count on you, and we are here to help you all along the way. Thank you very much, and hope we have another opportunity to interact in person. Thank you, Maha. Over to you.
Thank you very much, Dr. Rana. Also very inspiring and very much to the point. Very nice. Your personal touch actually is a good inspiration to many of the young people. We come now to the closure of this meeting, but like Dr. Rana said, I hope that we'll be able to meet more in the future, online, but also, inshallah, in person would be our aspiration for the next step. Yeah, and it's something that we all would like to see, and would like to see that this pandemic is over. Thank you all for your participation. I want to thank the earlier panelists who presented the case studies, Amra Hamami from Lebanon, Amira Rayan Abdel Hadi from Egypt, and Ali Thayab from Iraq. I want to thank what was called our senior, but they're all younger than me, so very much to thank very much Dr. Mohammed Abad, to thank Adham Ismail, and our dear friend Dr. Akiru Sita from UNRWA. Thank you all those who made interventions. Thank you, Batul, for your session. Really excellent. Very special thank to you, Jayatma. Really, I'm so happy that you joined us, and I like the way that you actually said that it was, nice that we also gave you the opportunity to listen to case studies from our region. I hope that you keep our region in your heart and mind, and I know you always do. It's like you said, it's a very challenging region. Thank you, Dr. Ahmed Al-Mandari, our regional director, and thank you, our DPM, Dr. Rana Hajja. Very special thanks I will take to Wasaq Khan for organizing this. He's a regional advisor for health promotion, social determinants of health in EMRO, and he's a young person himself, not so young as the presenters, but he gives very special attention to these issues. And since he joined us, he's been able to lead this with all his heart and mind to move forward the agenda for engaging the young people. So thank you very much, Wasaq, and thank you all those who helped, Mahdous and Ahmed, IT, and everyone else. I'm sorry if I have forgotten names. This is part of being senior. All the presenters who gave statement with Batul, please forgive me, all of you, if I had forgotten anybody. Not this is just me, but all very impressive presentations. Hope to see you again soon, and please make sure that we follow the recommendations and your suggestions of today. It is with you that we're going to move forward, and it is with you and with your push for us that our lives will be better, and the new world order, as Dr. Mohammed Abad mentioned or said, that these new settings are going to be better only by your support and by your contributions and your strong engagement and leadership. So thank you again. So good morning and good afternoon and good evening for anyone, depending on where you are. And many, many, many thanks beyond words can describe for being with us today. Thank you. Wasaq, you want to say something to close also? Yes.
Thank you. Thank you, Dr.